Hey guys, I am back. So a second ago, I actually got cut off a little bit early, but I think I said most of the things that needed to be said. What I want to talk about is a different chemical right now. This one's really important because it's implicated in the development of autoimmunity. It's implicated in some very serious autoimmune conditions like lupus, scleroderma. It's a carcinogen, which means it's cancer causing, and it's everywhere. Okay, it's another ubiquitous chemical that we need to be aware of. So, could this chemical be the cause of your thyroid autoimmunity? And the chemical is tetrachloroethylene. These are all mouthfuls, but they're chemical names. So, tetrachloroethylene. You find it in dry cleaning primary sources. Dry cleaning and metal degreasers are very, very common sources. Other places, so like if you utilize spot removers, it's very commonly found there. Paint removers, water repellents, dry cleaned clothes, leather products, adhesives, paper coatings, and chlorinated water. Chlorinated water. It's fantastic. These are some of the common places, but dry cleaning, metal degreasing are very common. But it's a lot of places, right? It's throughout the environment. It's commonly found drinking water contaminant. So it's very commonly found in drinking water. And this is a problem because it's been implicated in a lot of different types of degenerative conditions and autoimmunity especially. There's an increased risk of breast cancer with it. And the thing about this is that this chemical in particular, the tetrachloroethylene, it is lipid soluble, fat soluble. So there's water soluble stuff and then there's fat soluble chemicals. And so one of the things is this can basically dissolve into your fat. And where's your fat? It's like all your adipose tissue. So might you get exposed to this and gain weight and lock this stuff inside your fat cells? Absolutely. So might this stuff be in your tissues? Absolutely. So how do you get it out? Well, one of the things that you have to do is you have to detoxify those tissues, and you have to liberate that chemical from the fat. So how many of you have tried to lose weight or you've lost weight and you've had problems where as you're losing weight, maybe you start losing weight at first, but then you hit a plateau or you gain weight or you don't feel well? What if you have some of these fat-soluble chemicals in your fat cells, and as you're losing weight, you're liberating them back into the bloodstream? This is something that really happens, guys. There are other chemicals. This one, I don't know that this chemical is known to be an obesogen, one that decreases or promotes, let's just say promotes obesity. They work through a lot of different chemical mechanisms, but I don't know that this chemical is one that is an obesogen considered to promote obesity, but it definitely has a lot of negative effects, and it's definitely not going to optimize metabolism in any way. So it's going to have a negative impact, but I'm not sure how much with obesity. However, it is lipid soluble. It will store in the body fat. So one of the strategies that we have to utilize to get these chemicals out of our body is not just using a supplementation approach, not just clearing things out of our environment, but also we have to use dietary approaches that allow us to release body fat. And while we're doing that, we need to actively be trying to bind and clear these chemicals from our body the best that we possibly can. And you can't do this as just a sustained thing. You actually have to work on these detoxification processes. They need to be pulsed. So you have to prepare the body, then you have to pulse your detoxification. So you're detoxifying, you're utilizing dietary strategies to try and liberate some of these things from the fat tissues, then you stop for a period of time, and then you pulse again. That has to be something that you do, I think personally probably throughout your life, but especially during initial year or 1 or 2 years, you need to be doing that. You need to be doing that more actively, more frequently. So it's really important to understand that it's locked in the tissue. So we can't just take supplements. We can't just remove these things from our environment. We've got to do all that stuff, and then we have to use dietary strategies that allow us to utilize, feast and famine cycles, intermittent fasting, and some different things. I think that's the best way to do it, to unlock and get some of these things out of our tissues. Okay? So the EPA said 100, there was a study done, the EPA found that 100% of mothers that they checked in an urban setting, their breast milk had detectable levels of tetrachloroethylene. 100% of women in an urban setting where they tested their breast milk had tetrachloroethylene. Something that's known to be toxic to the immune system. Immunotoxic means it's toxic to the immune system. It's known to promote autoimmunity. Could something like this have triggered your thyroid autoimmunity? Could an exposure to something like this in any of these, from many of these sources, from chlorinated water, from spot removers, from paint removers, water repellents, dry cleaned clothes, leather products, adhesives, paper coatings, could a chemical like this be part of your perfect storm to develop thyroid autoimmunity? You cannot ignore this stuff, especially with the exploding rates of disease that we have. It cannot be ignored. If you ignore it at your own peril. If you say, you know what, I'm going to take the thyroid medications and I'm just going to not worry about it. I understand. It's not that that's inappropriate. It is that these problems, there are layers to these problems. This is not something that is singular. And so many people, they want to focus on one thing. And so many doctors, we only have time to focus on one thing. I understand that. And I understand that people are trying to do the best that they can. But you cannot ignore the fact that disease in the human body has multiple factors to it, and you have to look at it as holistically as you possibly can if you're expecting to try to really make a difference. And if you're not going to do that, then you're not going to have the best chance to have optimal outcomes. You're just not. So we cannot ignore these facts. Autoimmunity, systemic lupus erythematosus, SLE, lupus. This in particular has been associated with lupus, scleroderma as well. Autoimmunity to the skin, it's a connective tissue autoimmunity, diabetes, hepatitis, hematologic diseases, blood diseases, a carcinogen, as we said here, breast cancer. If you want to learn more about how I think that we've got to approach this epidemic of hidden toxicity in our environment, and guys, this is not the first time this has ever happened. Right? You know that throughout history, populations have been poisoned and didn't even know it. The Romans lined their aqueducts that brought the water in with lead. A lot of them were lined with lead. And we know that lead's a problem. I'm going to talk about lead in our webinar. So you can join me on the webinar, nomoretoxicbody.com, okay? No More Toxic Body. If you haven't registered, you need to register. If you are registered, watch your email because you're going to receive a notification 1 hour before the webinar, which is at, let me write it down. The webinar starts at 9 p.m. Eastern Time. Okay, Eastern Time. You will receive notifications 1 hour before the webinar and 15 minutes before the webinar. Okay, I'm going to send out a few emails. So if you're on our list and you've registered, you'll receive it because you'll get a link that will take you to the webinar broadcast room. Okay? I'm just hoping that you guys won't have any problems. It's going to go smoothly. We're going to be talking about these chemicals. We're going to be talking about common sources. I think the greatest and most potent offenders, the most dangerous chemical offenders, how we have to approach this stuff. And we're really going to talk about some testing as well that I think gives us the best opportunity to assess for the biggest problems. And so, guys, join me, No More Toxic Body, and I'm going to be talking about all this. But as usual, I appreciate you guys so much. I hope this helps you to improve your quality of life, to have better understanding of some of the potential issues and problems that we might be faced with, because it's a major issue. And I just want to make sure that you guys are as well informed as possible. Hey guys, Dr. Shook, thank you for viewing our videos. I hope they help you out. If you want to, just subscribe to our channel somewhere here. You can watch a video that YouTube's actually selected for you, so hopefully it'll help you out. If you need any other information or resources, just look in the description. We've got links to our website, to our 9 lab test guidebook, and everything else that we do. I really appreciate you, and I hope you guys have a great